Councillor Michael O'Brien.
Thank you. Delegates, this bundle of documentation represents emails, phone messages and calls that have come into my office in the past week, all from people who feel their children are getting a rough deal from our health services. Billions of euro has been spent on our health services, but we still don't have an adequate, never mind an excellent health service. Nowhere is this failure more pronounced than in the services for our kids. For so many, the expense of making sure their children get the best health care available can be huge. Even a very routine illness such as a chest infection can end up costing hard-working parents a significant sum between the cost of a couple of visits to the GP and filling whatever prescriptions are required. Where parents are forced to spend money on specialist care, such as speech therapy or on orthodontic treatment, the costs become astronomical. The cost can result in children not getting the treatment they may need. This must change. Our children's health will be better with Labour. Early detection and treatment of chronic conditions, dealing speedily with childhood illnesses, in addition to effective health screening, is not just cost-effective. It is a valuable investment in a healthy future for all of our children. Now, the key principle of Labour policy for child health is that all children must have timely and appropriate access to necessary care, whatever the financial status of their family. We believe that the foundation for a healthy Irish population is an effective and a comprehensive health service for all our children and adolescents. Ultimately, our goal is to ensure that everyone in the population is covered by health insurance. As an intermediate step, however, Labour in government will provide health insurance for all children up to the age of 16. This will provide secondary, and by that I mean hospital care, including guaranteed treatment times, quality and levels of service, an element of free GP care for children from 5 to 16 years. We are also committed to providing a health check and screening appointment by their GP or practice nurse for all children starting school. All young people will be enrolled in a health insurance package that will be free and paid for by the state. When a young person's family already has insurance, the state will pay the child's share of the insurance bill. Where the family is covered by a medical card, the young person will be enrolled with a health insurer at the state's expense, with the family choosing a standard health insurance package offered by a major insurer. The health insurance company will then provide insurance cover for the young person's acute care, while an integrated single-tier system of children's medicine. Children with medical cards will continue to be fully covered for all GP visits and for drug costs. This will be rolled out to include health check when pupils move from primary to secondary school, and the cost of care is a major barrier to access to GP care for many non-medical card patients, especially children and people on low incomes simply can't afford to go to a doctor because this government's policy of cutting back medical care card availability is beginning to bite. We are committed in Labour to excellence in the quality of care, fair access on the basis of medical need, and efficient use of resources to improve the quality of life for our children. Labour is committed to building the health service that the people in communities all over this country deserve.